Whole lot of things happening with Medicare. We want you to be informed so that you are not scammed and you don't risk your entire retirement account going away to scammers. So I'm going to share with you some things happening there. Also some good news with regard to Medicare, especially if you're a diabetic and you're using insulin. There's also an update about mental health. And seniors since COVID, when they were shut in, had some difficulty in this area, and it's still affecting seniors on Medicare with regard to accessing mental health. And you'll find out one particular type of Medicare plan is worse than another. I'm going to bring you that story. And then your feedback, sharing what other people have responded back to my content. It's going to be interesting for those of you who never see the comments to see what other people are going through. They're actually sharing their stories. Then my awesome granddaughter will make an appearance. But first, we're going to talk about the fraud that's going on. And this is something that I do not want you to be affected by. First, I'm going to share with you a friend of mine. His name is Steve Lato. Steve is somebody that I look up to a lot. He's got his own very popular YouTube channel, and he is a lawyer who focuses on consumer affairs and protecting seniors. But he's talking about mostly seniors are mailing checks to people to pay bills. Just the other day, our mailbox got knocked down by a drunk driver, and the person who repaired the mailbox said, just leave me a check in the mail. We don't want to leave a check out there or even use checks anymore, and here's why.
Whatever you do not put a check in an envelope with a stamp on it and put it in your mailbox with a flag up to indicate that the mailman should come by and take it. Someone driving down the street goes, oh, there's some mail for the taking. And by the way, there's certain envelopes that obviously contain checks, like the envelope that they send you.
See this? This is a normal check that would have gone right through. And you can see these routing numbers that are at the bottom. These routing numbers are your bank and then your specific account number. You do not want this information out there because somebody can just take this off the top as to who it's made out to and even change the amount and then take this right to your bank and present it for payment, and they're absolutely going to fulfill that. Don't want that to happen. I really recommend you don't use checks at all anymore.
For the power company, for instance. And if you look at that envelope, it's very specific, and someone will look at it and go, oh, that's obviously them paying their power bill. So that has led the post office in some areas to install high security mailboxes with small openings that won't take many envelopes, forcing customers to get out of their cars and go into the post office. Whoever is doing the theft, data on your bank checks can be used by sophisticated scam artists who can also change the name of the payee and even the amount of the check. I've heard of somebody actually taking a check made out to the power company, walking into their own bank and saying, I'd like to deposit this, please. And the bank either didn't catch or didn't care that it was made out to, Consumers Energy and not John Smith. So meanwhile, they say this is happening in the Pittsburgh region, elsewhere. An expert there said, yes, and this isn't anything new. Unfortunately, when it comes to different counterfeit checks and counterfeit check fraud, post office says if you must mail a check, avoid the mailbox and bring the envelope directly into the post office. They're saying that the box outside that you drive up to put stuff in, that's right there at the post office, they're saying that's not even safe. You need to walk inside the building and do it.
Quick story, here at my office, the Senior Savings Network, we send gift cards, American Express gift cards, anytime someone refers someone to us to become a client. We help them with their Medicare insurance, and we'll send out a gift card to the person who referred that person. Well, we got news that some of our gift cards were being used nefariously because they weren't being received by the person who we sent them to. So we called the U.S. Postal Service. They sent an inspector in here, and they put little tracking devices on our gift cards. We never heard back if they caught it, but it was actually the mail carrier. Right here in our office, we would go drop off the gift cards in there. They would feel that it's a card. They would take it open. They would either use it themselves or sell it on the dark web or to friends in the hood. We don't know. But this was a big problem, even here. And that's not even a check. So you got to be real careful, even with your mail carrier right at your house. Here's another one.
Opening it like the middle of the night.
After video
6 or 7 mailboxes in a row.
Showing thieves stealing mail from mailboxes, many even reaching inside USPS blue boxes.
We're talking about very high rate of fraud that we've never seen before.
David Maimon and his cybersecurity research team at Georgia State University monitor these criminals on the darknet to uncover emerging trends. The latest includes check washing, where thieves remove the dollar amount and recipient on the check and make it their own.
On the check, what you have is a series of details that the criminals are now using in order to open bank accounts, establish credit line, ask for loans, manufacture fake driver licenses, and buy weapons.
Maimon says this could happen to anyone, like Mark McPherson, who put a $445 check to his insurance company in his mailbox. He says 2 hours later, he got a call from his bank.
They asked me if I had written a check to an individual for that day for $2,700. He had told them that he was an electrician who had done work for me.
Maimon says thieves will sell checks like McPherson's online for about $250. Business checks, he says, go for up to $650, and arrow keys, which have access to Postal Service collection boxes, up to $7,000.
Have the folks who rob the mail carriers, the folks who go and sort through the checks, folks who help fetch the information from the credit bureaus and the banks.
You know, I grew up in a generation where we wrote checks for everything. Now I pay all my bills online.
In a statement, the Postal Service tells 11 Alive that it's working on a nationwide initiative to harden blue collection boxes, enhance collection box key and lock technology, and institute dual authentication for change of address protocols.
Pay bills online, deliver your mail to a post office, use a pen with non-erasable ink, and do not keep your mail sitting in your mailbox. And monitor your bank account and report any suspicious activity.
That's good advice. Again, if you can just stop using checks altogether, you can either pay by phone or pay online when you have a secure internet connection. And a lot of people don't realize that if you pay by credit card, and of course no one wants to pay that extra fee if they ever charge it, but if you pay by credit card, you have extra protection from federal law that if you want to challenge or dispute the payment that happened on the credit card, the banks must listen to you and must advocate for you and then return that money to your account. So using a credit card is a lot safer. Now, there's another scam that's going on, and this is specifically targeting people on Medicare. And this is where people are calling you, saying they're from Medicare, or billing you information, or using your billing information to sell you things and get you things, all billing Medicare on your behalf, but none of it's legitimate. Here's what's going on.
Familiar with the scam calls that target our phones these days, but one woman just learned that many of these callers are making false claims about being with Medicare.
Jill Eilers is recovering from a knee replacement and is trying to stay on top of her bills and coverage. So when she gets a medical-related call, she listens.
I answer the phone and they tell me, ask if I was Jill, and I say yes.
A recent call sounded important.
And they say that they are with Medicare and they want to send new cards.
But when they asked for her Medicare number, Jill realized she was about to be scammed. Zulfikar Ramzan is with the company Aura, which provides theft protection services. He says there are two main motivators for Medicare scams. The first is money. Scammers want financial information like your credit card number.
Hey, by the way, your card's going to expire, or here's a free kit to test for COVID. We just need you to pay for shipping.
The second is your Medicare and insurance information to be used in fraud schemes later on.
For example, can somebody get prescription drugs in your name using your insurance information?
Kathy Stokes, the director of fraud prevention programs with the AARP, says Medicare will never call you unless you initiate the conversation. She says hang up if you receive calls about increasing your benefits, updating your Medicare card, or taking tests in order to keep your benefits.
They're going to say, and if you don't take this test, we're going to block your Medicare benefits. So then they use fear.
Jill wants to get a message out to her older neighbors to just hang up on these calls.
They prey on the older people because they know that they're more likely to do what they want to do.
And that way you don't waste your money. I'm John Matarese.
Got to be real careful nowadays when someone's calling you and they're saying they're from Medicare, or they're saying that Medicare told them to call you. That's some pretty scary stuff. If you wouldn't mind, I've got a lot more content today. As a matter of fact, at the end of this, I'm going to share with you a very long video clip, and it's about 7 minutes, but you really want to see this. And this is where one of the U.S. senators goes hard against an insurance company, and it's things that happen to thousands of other people. I really want you to pay attention, so please stay in until the very end of this live stream. But if you have not yet done so, please subscribe to the channel. The vast majority of people will find us randomly out there. We call it find us by accident, but then they don't subscribe, so they don't get the latest information and the latest ways to avoid being scammed. But first of all, let me just recap. Please don't mail stuff in the mail using a check. It is the most dangerous thing you can do. But secondly, be careful with the phone calls that you receive. It's either usually somebody impersonating Medicare or somebody just trying to sign you up for a Medicare insurance plan, and they shouldn't be calling you anyway because it's highly, highly illegal. So what's going on with Medicare that's actually good news? Starting July 1st of 2023, which has already happened, of course, if you do the insulin pump and you get that through Part B of Medicare, B as in boy, that's everything outpatient, this is obtained through a durable medical equipment supplier, then that is not going to be more than $35 going forward. And you'll remember in January of 2023, they limited the price of insulin through Part D, and not all carriers participated in this, so you had to look carefully. And those Part D plans change every year. So it's important every year during the annual election period that you look closely at your Part D plan, especially if you're using insulin or anything that could be potentially expensive. There's a huge difference in the Part D plans. But this is talking about the Part B covered things, and those are things that are injected into you. In this case, it's actually an insulin pump. So it should be a cap on that. If you want to see that actual story, you can click right here on that QR code. You hover your phone over that right there, and it should pull up the link, or you can see in the description of this video later, and I'll have this link there if you want to see details on that. But that's supposed to impact absolutely everybody, and I hope that is good news for you or someone that you care about. Medicare Advantage is in the news a lot, and this is July 2023. This is new breaking information, and it's looking at the availability of psychiatrists on Medicare, particularly on Medicare Advantage. I want to share with you this new story, came out from the New York Times. If you can make it larger, Chris, they could probably read it. Let's see it. There we go. A new study finds that people have a very difficult time finding doctors in their networks under private sector policies. Well, wait a minute, what are private sector policies when somebody's supposedly on Medicare? Just to recap real quick, when you're on Medicare, you have two paths to go. You have the wide open path where Joe Namath and Bill Shatner and everybody else are pushing you into a private Medicare Advantage plan where they make billions of dollars in profit, and agents make a lot more profit by selling you those Medicare Advantage plans, often at no cost to you monthly. The cost is on the back end that you find out later if you get sick. But that's what I'm talking about here. This is just related to Medicare Advantage plans, which is not actually Medicare at all. It's a private plan. Let me read you this story. It's kind of new. Just happened July 5th. People with private Medicare coverage, that's again, Medicare Advantage, you've opted out for that year off of original Medicare. Now you're in a Medicare Advantage plan, so a private plan. People with Medicare Advantage coverage may not be getting the mental health services that they need because they cannot find a psychiatrist within their plan's network. I'll note, original Medicare, especially when combined with a Medicare supplement, is, in my opinion, the best creme de la creme, the best kind of coverage you can have. Yes, I know, and you'll put it in the comments, that not everybody can afford a Medicare supplement. So for those people, there are Medicare Advantage plans, and we can help with those. But original Medicare does not have a network. So when we're talking about a plan's network, we're specifically talking about the private, the Medicare Advantage plans. According to a new study, more than half of the counties the researchers studied did not have a single psychiatrist participating in a Medicare Advantage plan. That is huge. More than half the counties, more than half, don't even have one. In Medicare Advantage plan, the private sector counterpart to traditional Medicare. Some 30 million people, just over half of all participants in the federal program, are enrolled in these private plans. So they're not in original Medicare. You want to see this story for yourself? Again, click on that QR code there. Be happy to share with you the actual link so you can see if I'm telling the truth or not. The researchers, in an article published on Wednesday in the journal Health Affairs, found that of the plans reviewed, nearly 2/3 were narrow, with fewer than a quarter of available psychiatrists in the plan's networks. The networks offered under either Obamacare plan or Medicaid managed care were not as restrictive, and included about 40% of the available psychiatrists, according to the study. So what they're saying is Medicare Advantage is more restrictive than Obamacare's limited networks even. The more limited networks present a frustrating additional barrier to mental health services, even when on paper, and this is what we're going to talk about at the end of the video, on paper, there are sufficient number of providers in a geographic region, the researchers wrote. So on paper means when you're considering signing up for that Medicare Advantage plan and you're looking at that network and you're looking at that big old thick book there are more people in the book than actually exist in the network. We're going to share that with you at the end of this video. Do not leave. This is called padding the books. When they say we have this many providers in this big old thick like white pages, remember the white pages? Big old telephone book, and then you actually get it, and it's just a pamphlet. This is happening a lot in Medicare Advantage right now. The pandemic helped expose a widespread need for mental health services among older Americans, many of whom are struggling with loneliness, the loss of a loved one, or their own deteriorating health. While roughly 1 in 4 people enrolled in Medicare has a mental illness like depression, anxiety, or schizophrenia, an estimated half or fewer receive treatment. Why is that? According to a recent analysis of mental health coverage by the Commonwealth Fund, a nonprofit group. And they say, we need systems in place so people can easily find and afford the care they need, said Gretchen, the vice president of Commonwealth. It's not clear people are able to do so. Well, not on Medicare Advantage, because going out of network is costly. And remember, folks, if you're on a Medicare Advantage plan, especially a Medicare HMO plan, going out of the network means they will cover you zero unless it's a physical emergency. They'll cover you zero. And then, even if it is an emergency, just enough to get you stabilized, to get you back into a network facility, wherever that may be. So if you're on a network and you go out of the network, you pay that cost 100%. Going out of the network is costly. Many people will delay or skip treatment, said Dr. Jane Zhu, one of the study's authors and a primary care physician at Oregon Health and Science University. She said her own patients often had difficulty finding help. Quote, I was referring them out, but they could just not get access to any mental health providers. One of her patients called more than a dozen providers before getting an appointment, she said. Insurers say their goal is to provide a wide array of mental health services. Quote, everyone deserves access to effective, affordable, and equitable mental health support, said Christine Grau, a spokesman for the trade group that represents Medicare Advantage, known as AHIP. Of course, everyone deserves it, but are they getting it? More broadly, regulators and lawmakers have voiced concerns that people in the private Medicare plans, which is not Medicare, it's Medicare Advantage, so you're out of Medicare, it's Medicare Advantage plans, may not be getting the services they are entitled to. And this is the biggest word that J.J. Walker and all those people on TV are saying, get the benefits that you're entitled to. Whenever you hear that and they're spoon feeding you this BS, that means that they're trying to sell you something. Anyway, they're not getting on these plans. They're not getting the services that they are actually entitled to by having been on Medicare. Critics have long complained about inadequate access to mental health services. Senator Ron Wyden, an Oregon Democrat who leads the Senate Finance Committee, held a hearing in May about so-called ghost networks. I'm going to share that with you at the end of this video. It is very eye-opening. Ghost networks of mental health providers in which many of the clinicians listed in the Medicare Advantage plans directories are not, in fact, accepting patients. So they might as well not even be in the directory. His staff conducted a secret shopper survey and could only obtain an appointment 18% of the time. So if 18% of the people were available, actually, what does that mean? Are they actually able to be in the directory? The Health Affairs study may have overstated the availability of psychiatrists. Remember when it said that 40% in one county were actually available in the Medicare Advantage HMO? So their study, according to the New York Times investigation, overstated the availability of psychiatrists because it only looked at which providers were listed in the plan's directory. Well, if they're listed there, does that actually mean that they're available and taking new patients? It likely paints a rosier picture, the doctor said. Doctors may be unwilling to participate in Medicare Advantage. Why? Because of the low payments paid by insurers, coupled with all the required paperwork, said Dr. Robert Trustman, who is the chairman of the Council of Healthcare Systems and Financing for the American Psychiatric Association. Oh, he's got some credibility. And he testified at the Senate hearing. Many of the challenges and frustrations are emphasized in the Medicare Advantage plans. And let me just show you what the president of the American Medical Association talked about. It's a 20-second clip, but listen to what he said about this.
We see this all the time. This is health plans delaying and denying care. That same patient, once they finally find the needle in the haystack and even get to a physician who's in network and sit down and get a diagnosis and a treatment plan, then goes to the pharmacy and discovers the health plan requires prior auth for the treatment for that condition, which then it takes weeks to get approved. Sometimes they never go back to the pharmacy, they give up. their mental health or their other chronic condition gets worse.
And now you just heard the president of the AMA talking about this very problem. I think that's got some credibility here. Many of the challenges and frustrations are emphasized in the Medicare Advantage plans, he said. Unbelievable. Some insurers pay psychiatrists less under their Medicare Advantage plans than traditional Medicare pays for the same services, the researchers said. Say it ain't so. The plans may, and I've called this the lowest bidder problem. When you have doctors, a lot of them from foreign countries, there's nothing wrong with that. They've got the proper skills and training, but they are often the ones that you'll find in the HMOs that are putting out the lowest bid just to get doctors into their networks because they'll accept the lower payments. Some of the best doctors out there do not accept the lower capitated payments, and they're not found in these private networks. The plans may also have an incentive to contract with smaller groups of doctors to have more control over the costs. And that's what it comes down to. And care being delivered, the researchers said. And you can see this whole article right there in the QR code to see that it's legit. There's a different study. This is from U.S. News and World Report. They took it even further by taking the health affairs study and adding a couple of facts to it. In some areas, not even one psychiatrist who accepted Medicare Advantage patients was taking on new patients. The effect on patients is that they may have to pay higher out-of-pocket costs. Well, they would have to pay 100% if they go out of network, experience delays in care, or not get the care at all. More than half the counties did not have a single person in there. Our findings offer upper bound estimates on network breadth, raising concerns about Medicare Advantage enrollees' access to mental health services amid the growing prevalence of mental health conditions among older adults. That's a bad thing, folks. The very bad thing. Oh, who is this little one making a brief appearance here? That is the cutest kid in the whole wide world. That is little Scarlett Nicole. I get distracted. Again, stick around for the video that's at the very, very, very end of this. You're going to really enjoy it, where I go in depth on this. Wait a minute. Got another one? Oh, my goodness. That is the cutest little kid. I am telling you right now. She's so much fun to be around. Did I have sound in this? And she smiles all the time. Happy baby. So anyway, if you have not yet done so, please subscribe to the channel. And now I want to share with you some of the stories, some of the comments, some of the things that people have been leaving. I've been asking you to do that. It is important to comment for sure. Share with me what you've been going through, what you've experienced. A lot of professionals, doctors, nurses, discharge planners, people that work in hospitals, they've been sharing their stories here. Now, if you have a specific situation, and by that I mean you need a question about your specific case, and you're coming up with a decision, you have something you need to do, then you need to contact us at the website or the phone number down there so we can help with your Medicare insurance. But we can't always get to the comments every single day. There are literally hundreds coming through a day. So if it's something that's timely, reach out to us. But if you can share your story with us like these. My husband suffered with cancer and couldn't get the help under this particular Medicare Advantage plan. He suffered horribly for 4 months and then he died. And I share these with you not because they're one-off, just because these are actual stories that people are going through on these plans. And somebody will, no doubt, comment, as many people have. I want a Medicare Advantage plan. I've been on it for 13 months. I've been on it for 23 months. And I've never had a problem whatsoever. And that is wonderful. And that's why we also help people enroll in Medicare Advantage plans where it's appropriate. But by gosh, we're going to give you the education so you know what to expect. So you don't say, oh my God, my agent never told me this could possibly happen. So if you want an advocate, you want somebody to reach out and actually try to help you with things, then you should consider who you're going to have as your Medicare agent. That's all I'm saying. These plans should be illegal, she said. I did my research and all the agents sitting in supermarkets and Walmarts are pushing Medicare Advantage. That is absolutely true. The Medicare Advantage companies will actually put those people there, and they sell that space so that those people can be there and sell you a Medicare Advantage plan. I found Christopher Westfall's channel and got a Cigna Medigap policy for $75 a month. People don't take any Medicare Advantage plan, please. That's just her opinion, but I wanted to share it with you because it's legitimate. Let's see if I can make these a little bit larger so you can see them better. Thank you, Chris, for reminding people that hospitals, doctors, offices, ambulatory care centers, rehab facilities, nursing homes can bow out of their contracts with Advantage plans at any time during the year. I've said that often. It bears repeating. It's absolutely true. When you use the directory, and again, stick around for the video at the very end here, where I'm going to show you this Senate testimony you don't want to hear about ghost networks and what you can rely or not rely on with regard to your Medicare Advantage plan. Very important. They don't tell people when they sign up for one of these disadvantage plans that, yes, they can bow out. Those doctors and hospitals and everything can leave, and I bring those to you all the time. They can leave in the middle of the year. This comment was on one of my excess charge videos. I'm probably going to call. Do you have a video on the D plan? That's Part D. Some brokers may get short-term benefit on upselling, but it's the honest ones who will get the best base of clients in the long term that will make you a better agent. Plus, you sleep better at night. That's what I tell all the agents I train. What you need to be able to do is build a business with integrity and honesty so that you can sleep better at night, knowing that you're building a base of people that you've helped and that they will, based on your efforts, go out there and share your information with other people. That's how we've grown, by never having debt in our agency and having now 20 employees, just by helping people. And yes, information on the D plan. Let's see if I've got this up here. And of course, you can only change your Part D plan during several times of the year. Notably when you're brand new to Medicare, when you're leaving an employer-based plan or leaving COBRA, or you're moving outside a service area, you can pick another Part D plan then, or during the annual enrollment period, which is for the Part D plans, October 15th through December 7th, every single year. And yeah, we have a website where you can see all the Part D stuff, and I'll show it right there. Part D plans and enrollment information can be found at startpartd.com. You can see that any time of the year, anytime you're eligible to change plans, or during the annual enrollment period. This is actually a Medicare agent. I'm a Medicare broker. I truly believe that original Medicare and a supplement is the best way to go. However, a lot of the people I have encountered cannot afford a supplement, not even plan in, because of the cost. Medicare Advantage with a supplemental policy, he's talking about a different thing there. He's talking about a hospital indemnity plan or copay plan. I've heard somebody else market it lately. Medicare Advantage plan with one of those is the only option that they have. Yes, Advantage plans have gaps just like original Medicare, and it's our responsibility to educate clients. And I'll tell you, you should really spend some more time on my channel where I'm talking about the huge gaps that they do have. Some of those you can actually get taken care of by other help. And that is, like, for instance, a cancer plan. If you do have a Medicare Advantage plan and you look very carefully at the summary of benefits, you will note that cancer treatment is only covered at 80%, meaning that you have to cover the other 20%. It's been highly recommended that people that do choose a zero premium Medicare Advantage plan will also supplement that with a cancer policy specific to just cancer. The first onset of diagnosis of invasive cancer, you get a cash payment made directly to you. Many of our clients have. And what that can do is help you cover your max out of pocket on your Medicare Advantage plan. We typically recommend 2 times or more your max out of pocket. Why? Because it's happened to my grandmother when she was on Medicare Advantage and she got cancer and she had to face this. She had to reach her maximum out of pocket, and then January 1 happened while she was being treated and she had to hit the maximum out of pocket again. So at least 2 times the coverage of your max out of pocket, at least on the cancer plan. And yes, we have other policies that will supplement your Advantage plan and help with the hospital copays and the significant things you have to pay, like ambulance rides and things like that. That's what this agent's saying. If you're going to get an Advantage plan, at least get one of those plans that can help you when the times get tough, because eventually they will. This is long, which I had to squeeze it in here. I've been a nurse for 48 years. Medicare Advantage plans are the biggest scam out there. This is not me saying it. I'm just sharing what this person is sharing. I remember when HMOs were introduced back in the 1980s. What a fiasco that was, too. I cannot believe that insurance agents with any kind of ethics would suggest a Medicare Advantage policy. Shame on them. And do these people that think zero premium is going to really save them money? Take a look at the small print, like we're doing here with this, because I squeezed it. Take a look at what doctors and hospital systems are not included in your policy. Take a look at the deductibles you will pay. I'm talking about the big copays for things that are significant, like cancer, like skilled nursing. Do you think that, oh, I'm healthy, so I don't really use health insurance? Well, let me tell you that at some point you will have a medical issue and wind up in your doctor's office or see us in the hospital. You are not invincible. You are getting older and will have issues. Wake up. That's her 2 cents, and I really do appreciate that. Thank you, Chris. You have the best YouTube channel The cold hard facts regarding all these things Medicare. My Advantage story involves being turned down by a cardiologist not in network on my HMO plan. Luckily, the in-network doctor I saw retested and added a new medication that works wonderfully, keeping me well so that I can get a Medigap plan soon, as I'm turning 65 this December. Working with your girl, Kendall, so I'm prepared for this do-over, because if you're on Medicare prior to age 65, you have Medicare due to disability. And I have a website that talks about what your options there are, MedicareOnDisability.com. I don't have it in a ticker. Let me see if I can put that on there. MedicareOnDisability.com. Yes, I do. Now I do. So if you see that, MedicareOnDisability.com, if you're eligible for Medicare under the age of 65, that's where you can see what your options are. But this person's talking about their do-over. They get a do-over because they're turning 65, and they have their initial election period, version 2, and they can then choose any plan in the market. And this person is deciding to go on the Medicare supplement plan. Prepared to do this do-over with the best plan for me. Been on SSDI, Social Security Disability Income, for the past 6 years, and when coming off Medicaid, being switched to Medicare only, Advantage plans were presented to me as the alternative. Thank God I get this do-over opportunity, otherwise stuck in Advantage for life. Happy for New Yorkers on, yeah, that was a good deal. It happened with New York. We did in our last live stream. My employer plan is ending. Plan in New Jersey with United Healthcare and other insurance companies have no underwriting for Plan N. They do have underwriting for United Healthcare Plan G. Perhaps there are differences by state, but N has no underwriting requirement. And that's not true. That's just your limited experience with that. And let me share with you in context what's really happening. When your employer plan is ending and you weren't on Part B before, you didn't need Part B of Medicare because you're on your employer plan that had more than 20 employees. And if you are on an employer plan and you're past 65, you don't have to start Medicare. You don't have to start Part B of Medicare at all. And that's what happened here. When you do start Medicare, because your employer plan is ending, now you're in your initial election period, just like you're turning 65 all over again because you're a brand new Medicare baby. Your Part B is starting. And that opens up Pandora's box. You can get Plan A, Plan B, Plan C, Plan D, Plan F, whatever plan you want, or the Medicare Advantage plan. Now, on this particular plan, they do have a disappearing discount when you first start on the plan, otherwise known as a built-in rate increase. I can get in that in depth if you contact our office, but I want our people to be on a plan that has no hidden things in there, and that's why we recommend other plans usually. But yeah, when you're brand new to Part B, you can do any plan that's available with no underwriting. It's fantastic. My husband got a plan in with AARP United Healthcare in Texas, and the rate increases have been higher than you stated in your video. Again, this is due to their particular disappearing discount. A disappearing discount is otherwise translated into a guaranteed rate increase on top of the real rate increase. They were 5.1%. So the lowest copay he paid was $16, but I would say that the average copay has been $18 overall. We're happy with Plan N, and he gets Renew Active as an added bonus with the plan. Thanks for Chris for the very informative video. I knew before I retired to not get an Advantage plan. I'm a retired RN, had worked in oncology. That's cancer. Lots of problems getting prior authorization for treatments, as well as an explanation to already stressed patients that they owe lots of money. We talked about this in the live stream. If you didn't watch it, you really, really should. Where a cancer doctor unloaded specifically about Medicare Advantage. And this is almost the last one of these. The new rules for January 2024 sound great, talking about Medicare Advantage, and they're trying to rein in prior authorization, which is such a big problem there, and only there. I have my doubts. There is so much corruption in this industry. The lobbyists are likely working very hard right now, lining the pockets of those who are in positions to make the changes. They're contributing to their campaigns, let's be honest. What happens to the older population after an acute hospitalization is nothing short of a crime. As a nurse who has worked clinically in utilization review and appeals, I see it every day. That tells me credibility. If people can afford straight Medicare, they should take that with a gap plan. If you don't read our comments, I'm telling you, you're missing out. There are a lot of great conversations going on in there about people who are seeing the worst case scenarios on these plans and seeing how they perform on both sides of the coin. I've just been prescribed one of those drugs that has to be administered in an infusion clinic. We're talking again about Part B as in boy drugs on original Medicare. If it has to be provided in a clinic like chemotherapy, some infusions for rheumatoid arthritis, etc., if they're administered in a doctor setting, then Part B of Medicare takes care of it, all of it, 80% of it, and that's where the supplement would then kick in and do 20%. Any doctor, any hospital, any infusion clinic, any of them are covered by original Medicare. I'm one happy gal that I listened to Christopher before I faced Medicare decisions. So she obviously has a Medicare supplement and pays nothing for that. Here's our contact information. I'm getting to that video right now about the Senate interview, talking about what's going on with the ghost networks. But let me just preface it with this before I leave. Call us with your questions about how we can help you on your Medicare plan. If you're not happy with your Medicare plan, if you've got a rate increase, we just had one yesterday where we saved a person $2,100 a year. They want to do an interview with me, so I'm hopefully going to bring that to you in a future live stream here about how we got them on the same plan, but are saving them $2,100 a year because they didn't know before watching our video that you could save money on the same plan letter, the same plan type that you have, if you simply let us shop that plan for you. Actually, I have one of those right here. If you wonder what is involved in getting your existing Medicare plan to get rewritten so you can have a less expensive version of what you already have and the same benefits and no interruption and all that, then go to that website there, seniorsavings.org/underwritten. I'll tell you what the underwriting is. We'll go right through it. We have all the companies we can help you with that. So here's the video. But before I show you the video, I'm going to ask you a favor. That favor is this. Please pay attention to the words of the witnesses, okay? If you don't like the senator that's involved because of the letter that's after their name, please hear me. Listen to the message of the witnesses, not the senator that's bringing it to you. Invariably, every single time, no matter if it's a Republican talking or a Democrat talking, and they're sharing stuff in one of these oversight committees, a lot of people will say, well, I'm just not going to listen to them because look who it is. Well, don't listen to who it is. Listen to the witnesses that they brought there and the context, and don't miss the message for the messenger. I encourage you that because I don't want you to miss out on this vital information here. This is a clip that you will be finding fascinating because this is how they're getting people into these plans and then what happens once they're on the plans. So here's the video and I'll see you at the other end.
So America is facing a mental health crisis. 1 in 5 Americans live with a mental illness, and for Medicare beneficiaries, it's 1 in 4. Federal law requires Medicare to cover mental health services in both traditional Medicare and Medicare Advantage, or MA, the program that allows private insurance companies to offer Medicare coverage. Now, unlike traditional Medicare, the private insurance companies in Medicare Advantage can establish networks to restrict the doctors or facilities that beneficiaries can use. So if your doctor is in network, the plan will cover those services for a small copay, but an out-of-network doctor can leave patients with skyrocketing costs. This can be especially devastating for seniors or for people with disabilities who are more likely to be living on fixed incomes. To help beneficiaries avoid these surprise costs, MA plans are required to publish directories which enrollees can use to find new doctors or to make sure their existing doctors are covered. So let's start with what we know about the accuracy of these directories. There have been some references to them, but Ms. Gilberti, did I say it right, Ms. Gilberti? What do we know about the accuracy of the provider directories in Medicare Advantage?
So CMS has done some audits, Senator, and what they found was on average, the accuracy rate was about 45%. So,
what does that mean that the accuracy rate is 45%?
You know, they found in 2018, I think it was, almost 50% had at least one inaccuracy. So, we're seeing a good deal of inaccuracies. That's with physical health care. Just say there's a gap in data because they haven't done this for behavioral health.
And might we surmise that behavioral health accuracy.
Worse. It's always worse.
It's always worse. It's always worse. Okay. So you think you've got a list of people you can go to, and the odds are actually in favor of the list is wrong, and probably even worse on behavioral health. All right. So here we've got a patient who does everything right. They still may be hit with a huge bill because a directory has outdated or inaccurate information. We know that MA plans use all kinds of tricks and traps to squeeze more money out of Medicare. They've got a lot of different ways that they do this to boost their numbers. But here's the one I want to focus on. Do these MA plans stand to gain anything from having inaccurate information? In other words, Is it inaccurate because they just haven't spent enough money to make it accurate, or is it inaccurate by design?
Well, I think there are advantages that they have when their directories, unfortunately, are inaccurate. If they use those directories for network adequacy standards, for example, they might meet the standards, but they're not accurate. People make choices based on what they see as their network. So if it looks like a bigger network, but it's not real, people are choosing a plan.
Okay, so it's a way to defraud consumers. To say, I have this really big list of people you could go to if you had a problem. And it turns out that really big list, if it were accurate, is actually this little tiny list. Right? Okay.
Right. And then,
so that's one way. It's to the advantage of the Medicare Advantage plan in order to be inaccurate. They get paid, in effect, or they make more money by being inaccurate. Did you have another one?
well, just that, I think it's about 60% of the plans don't have out-of-network coverage. So if you get really frustrated and you pay on your own, then they're not paying anything.
So the more I can frustrate you, the more that meaning the Medicare Advantage plan, the more the Medicare Advantage plan can frustrate you, the more you'll just go somewhere else. And that means it's not money out of their pockets. Did we get the two main ones you wanted to add?
I just was going to add, Senator, we see this all the time. This is health plans delaying and denying care. That same patient, once they finally find the needle in the haystack and even get to a physician who's in network and sit down and get a diagnosis and a treatment plan, then goes to the pharmacy and discovers the health plan requires prior auth for the treatment for that condition, which then it takes weeks to get approved. Sometimes they never go back to the pharmacy. They give up. Their mental health or their other chronic condition gets worse.
So conditions get worse and they don't have to pay for the treatment, this Medicare Advantage plan. So look, what we're really saying here is that it is in the financial interests of these Medicare Advantage plans to discourage beneficiaries from accessing care. We also know that the Medicare Advantage plans are paid a set amount per beneficiary, which can be dialed up if the beneficiary is sicker. So the more diagnosis codes that a beneficiary has, the higher the payment. The insurance companies have built entire businesses around making these beneficiaries look as sick as possible and then overcharging taxpayers by hundreds of billions of dollars. Because here's the key that underlines this. Whatever insurers don't spend on care as a result of tactics like outdated provider directories or overly restrictive networks or inaccurate information, whatever they don't spend on care, they get to keep. So let me ask you one last question on this. What penalties, Ms. Gilberti, do MA plans face for being out of compliance with regulations and provider directories and network adequacy? So we got a bunch of rules. When they're in violation of the rules, what's the consequence?
I'm not aware of any penalties, Senator. The audit that I mentioned earlier talks about like notices of noncompliance and warning letters, but they don't mention anything about penalties. So I know there's been some legislative proposals to that effect, but I'm just not aware of any penalties that are being assessed.
I tell you, nobody's jumping in with any other answer. You know, this is the part that just drives me crazy. People look at the regulation, they think, oh, well, we're going to be okay because this is regulated. But we're not okay if there's no enforcement. Now, to the extent they have enforcement tools, CMS really needs to step up the enforcement here. At a minimum, beneficiaries should not be on the hook for out-of-network costs that were incurred because of inaccurate directories. That'd be a nice starting place on this. CMS should also penalize Medicare Advantage plans that are out of compliance. Just put penalties on these guys. And it's Congress's job to put tougher regulations in place. And I also want to say this. If these Medicare Advantage plans continue to mislead beneficiaries about covered providers at the same time that they are overcharging taxpayers for this crummy coverage, then we should be taking another look at whether or not MA plans should continue to enjoy the privilege of restricting provider networks at all. Now, there's a serious question that should be on the table. If they can't do better in managing these restricted networks, then maybe they ought to have to cover anyone who's a licensed practitioner that you go to see.
Never happened. but it's a nice thought. Just like Medicare for all would be great for a lot of people if it could happen, but there's no way to pay for it, and that's the challenge. Listen, I want to thank you very much for watching today. I really want to ask you a huge favor. Please share this information with someone who's making the critical life choice of where to go. People that are new to Medicare often have no idea where they really should go, and they don't know who's going to give them those answers. And one more thing that a lot of people will always ask is, why is it that you're running a business helping people with Medicare? And why am I so passionate about it? The second part I can't tell you. But if there's a news story or something happening with Medicare, I'm all over it because it is my passion. It's not just something that I do Monday through Friday, 9 to 5. Well, obviously. But people have always asked, like, how do you get paid? How does a person get paid? Do I have to pay you for your services? Somebody actually wrote in the other day and said, I want to send a contribution to Chris for it. Well, no, we're not a nonprofit. We help people, and the good things just happen to us when we do. What do I mean? Insurance companies pay us for helping people to be on certain plans. They pay us a lot more money to put a person new to Medicare on a Medicare Advantage plan. They pay us less money to put people on a Medicare supplement plan. On a Plan G, they pay us more than if we put them on a Plan N. But you know what we do? We sleep really well at night because we want to give all of our clients the most important information possible, which is, here's the good, here's the bad. Now you make your own choice. But we get paid either way. Some plans we get paid a lot more for, and a lot of agents that you will talk to are only pushing those plans, maybe for a reason, maybe not. Draw your own conclusion. And then we get paid less for other plans too. Those plans that we write 90% of the time, because we go through all this with everybody, we get paid the least on those plans. Make your own judgment as to who you want to get advice from. Somebody who's driven just from the money. And even on the Medigap side, pushing Plan G to every single person you talk to because it's simple and it pays you the most is repugnant in my mind. But anyway, don't want to get on a high horse here. Just find somebody to work with that you can jive with. And my team here, we work very closely, educate everybody in here every single week. We get together, go over everything that's new with Medicare, what our clients are going through, how we can best serve our customers. And we do business all over the country. So if there's anything we can help you with regard to Medicare, please do reach out. Thank you so much for being a part today. God bless you. And I hope to see you on the next live stream. And please share information with somebody, anybody. Just share it with somebody. Make sure you're subscribed. Thanks so much. Bye-bye.